Hi, Dr. Roos. Hi, Dr. Cameron. How are you?
Good,
Good.
thank you. How are you?
Good, we're doing well, thank you. So this is Miguel, and I'm Rhea, and we are the Professional Relations Directors for this year's Project Pulse Winnipeg team. We are so happy to have both of you here today. Would you both like to briefly introduce yourselves?
Go ahead, Emily.
Hi, I'm Dr. Emily Cameron. I'm an Associate Postdoctoral Fellow at the University of Manitoba, working with Dr. Leslie Roos.
And hi, I'm Dr. Leslie Roos. I'm an assistant professor in the Department of Psychology at the University of Manitoba with a cross appointment in pediatrics. And I'm a co-director of the Hearts and Minds Lab.
Thank you both for those introductions. It's very nice to meet you both. Before we begin, let us tell you more about Project Pulse. Project Pulse Winnipeg is a branch of the nationwide youth-led initiative that strives to familiarize high school students with the world of health sciences. We are a nonprofit organization composed of high school and early post-secondary students, and through our conferences and online platforms, we connect students with professionals, university students, and other distinguished individuals in the field like yourselves. Do either of you have any questions about us or what we do?
No, I've heard great things, and I think it's a wonderful initiative to expose high school students to some of the different opportunities that exist out there.
I agree.
Great, thank you. So in terms of the format of the interview, we will be asking two types of questions. Most of them will be general questions, which both of you or just one of you can answer, and some will be questions directed towards a specific person. We will make it clear which type of question we are asking before we ask it. Are there any questions about this? Okay, great. With that, let's begin.
Great, so our first question is a general question, and it is, what drew you to the field of psychology?
I can start a little bit. I was first interested in visual arts and environmental science, and I realized when I tried a few different internships, working and volunteering for different organizations, that I really liked working with people. So I became interested in psychology for the opportunity to work more directly with clients and in a team environment. And also, I think lots of folks experience mental health challenges or have mental health challenges that they notice in their family or friends and larger community. And I became really interested in learning more about different ways to support people from the mindset of helping people sort of reach their own goals, and that mental illness often gets in the way of people's ability to achieve the types of things that they're hoping to aim for in their lives.
I took a bit of a different route. I was first interested in more biology. I went to university to study biology, and I hadn't been exposed to psychology at the high school level. So when I got to university and started taking some classes and took a psychology course as an elective, I was just very interested in human psychology and this interaction between our behavior and our mind and brain. And I changed my major to a combined biology and psychology major and focused on psychology throughout my undergrad. And at the same time, I was working with youth in a Big Brothers Big Sisters program, running groups. And I really loved doing that and spending time with these youth, working through the issues that they were bringing to group each week. And so kind of as a culmination of all of that and getting into clinical psychology research at the undergraduate level, I was just very interested in pursuing clinical psychology in graduate school. And in particular working with youth and families to support child development. So that was more my route.
Okay, thank you to both of you for sharing your stories. Our next question is specifically for Dr. Roos, and the question is, what advantages do you see to being in research, specifically in clinical psychology, in comparison to other medical fields?
Sure. So, research in psychology, I think, is at a really exciting place in the field because we're now sitting on about 50 years of research that shows that with concerted efforts, we really do have a number of evidence-based services to improve mental health and well-being, across the lifespan. At the same time, I think there's pretty consistent results. And talking to folks working in the mental health field, most people would agree that it's challenging to always improve mental health as much as you want to. We see effects on average, but these effects might not be as big as we want them to or as long lasting as we want to. So I think there's a real opportunity now to sit on a solid foundation and improve things beyond sort of the status quo. So a lot is known, but there's a lot more to know. I also think in clinical psychology, it's a really interesting option to, do research on how to improve mental health services and do research on the underlying mechanisms of psychopathology. But to be able to do so while you're also working with clients and families, I think it's really, inspirational to be working with families and see how hard they work towards improving their own being and the well-being of the people around them. And also to be, inspired and gain new insights about why maybe the program that you're working with doesn't quite meet their needs. So I think we draw a lot of ideas in our research about new directions or things that need to be adjusted based on working with clients directly. There's quite a nice balance of that in the field of clinical psychology.
Great, thank you for those insights. This next question is for Dr. Cameron. Can you explain some specifics of university when going into psychology, such as how many years of university does one generally need for the field, etc.?
Certainly. It's a little bit different depending on, I think Dr. Roos could also speak a little more to the US universities. I went to graduate school in Canada, and I know in my experience applying at that time, an honors degree was required. So that is at the bachelor's level. Typically it's an extra year, or at the University of Manitoba, it looks a little bit different, but it's a specialized year of research where you write a thesis and conduct a research study. So it gives you exposure to that research experience. So for me, I did my degree in 4 years and added on that honors year. So my experience took 5 years. Some people do that in 4 years, and some people take a bit longer depending on how they've approached it. For getting into clinical psychology in particular, honors degrees are pretty normative at this point, as well as having some additional lab experiences can be really important. So getting involved in a research lab as a research assistant, that might look like helping to collect data or recruit participants. And that can be helpful to do earlier on in your graduate or in your undergraduate training. For me, I got involved in my 3rd year of university. So I had 2 years of research experience before my honors degree. And I worked in across 3 different labs over those few years, and had lots of different experiences. So really getting involved helps as well to both set yourself up for success in your honors year and have those useful experiences that might result in a publication, and also have experiences presenting research at conferences. So I had a number of poster presentations that I was able to present at a local conference, and then as well as at a national conference. So having, what's more colloquially talked about is like lines on the CV. So having a few, some good actual experiences and having a few things that can kind of show what you've done is really helpful. It's a little more normative now for graduate students or people trying to enter graduate school to have some publications. So getting involved in research as well as all the way at the manuscript level can be really helpful. And I know in the Hearts and Minds Lab, that's the approach we take with undergraduate students, is really helping mentor and train students across their different levels to be involved in conference presentations and manuscripts as they can be. And then at the graduate level, continuing those experiences. So a clinical psychology degree typically is either a combined master's and PhD, or ultimately just a PhD program, versus some other psychology programs would be more specifically just a master's and then applying again for the PhD program. So kind of the stream that you're interested in going in would look a little bit different as well.
Thank you. Just a follow-up question to that. Does one need to go to medical school for psychology?
That's a great question. No, they don't. So typically it would be a bachelor's degree in a related field. So mine was a combined biology and psychology degree. But what is more important is more just having some of those prerequisite courses. So you could have not a psychology bachelor's degree, but have taken some of the courses that would be relevant, like statistics and psychology and those types of things. If you get a bachelor's degree and then also want to update your courses to then be able to go to graduate school, that's okay too. But there's no medical school. That would be a different route. So Dr. Roos and I both have PhDs or doctorates of philosophy and not medical degrees.
Thank you for providing us with that information. Our next question is a general question. So what did you personally do in high school and undergraduate school to help prepare you for this field? And what obstacles did you face during your education? Dr. Cameron, I know you touched on this a little bit, but perhaps talking more about what you specifically did and how that helped you. This is for both of you, by the way.
Sure, I can start and extend what I was just saying. So for me, I would consider an obstacle to ultimately where I got to, in that some of my peers in university had been able to take psychology in high school, and they had a little more certainty on the direction that they wanted to take. I didn't decide wholeheartedly that I was going into clinical psychology until my fourth year of my undergraduate degree, when I decided to do an honors thesis. So in high school, I took I focused primarily on science courses. I took more science co-op type studies. I did my biology and chemistry and physics courses within a co-op approach where I did different practical or internship experiences, and I was intending to focus on those more hard sciences going into undergrad, and ultimately considering going into medicine. So a lot of what I was doing at that time was also consistent with what would have been helpful to get into grad school. So I was volunteering, I got a lot of different experiences and developed a lot of different skills. I was working with people. I did a co-op where I was working with animals. So lots of different opportunities to volunteer and create a good resume of having experiences and being dedicated to what I was doing. That being said, I would say that there wasn't anything that I did in high school necessarily, other than, you know, what was needed to get into university, that was more important than what I did in university. So really getting into labs and volunteering and picking up those skills a little bit later in my university degree was more important than anything in high school. Leslie or Dr. Roos?
Yeah, it's an interesting question. I think my sort of looking back, my biggest suggestion would be that it's really challenging from classes alone to know what type of career path you might be happy doing. So although the classes are important, I would consider, you know, other experiences, joining a research lab, you know, jobs related to the field to be the absolutely most important information that students can get starting in high school to inform what they might want to do. I think, you know, as I mentioned, I did tried to do 2 other career paths before I realized that I really loved psychology. So I spent a couple summers in high school sitting in walk-in freezers, taking notes of frozen fish guts with the experimental lakes area. I had to document everything that was in these like 20-year-old freezers. And it was really lonely. And I went out to the lakes and I took water samples, and it was really lonely too. And I realized that I didn't want to do that. And then in college, I took a lot of art classes, but I took a really challenging class that was more applied arts and architecture. And I really loved it, but I wasn't great at it. I failed the class. And it was really important for me to have those experiences of being unhappy in what I thought I wanted to do, to push me to keep trying to find opportunities to land on something that I really wanted to do. And I really found that in psychology. I liked the classes. I did an independent seminar with a professor related to eating disorders in college students that I liked. And then after college, I found it really beneficial to work for a year in the mental health field. So I did clinical interviews with people who are managing mental illness and homelessness. And that was really impactful for just seeing how, trajectories of mental illness can affect folks' well-beings, and how when you help improve mental illness, it can really allow people to take concrete steps towards their goals, whatever those might be. So I think really getting that experience, even if it's in like a sort of weird job, a weird volunteer position, and trying out a lot of different things, is the most important advice I would have for students trying to identify a career that they're going to feel satisfied in and excited to be doing the work every day.
If I can add one more thought too, that is that a lot of the directions that I took in university were based on people suggesting things that I hadn't thought of yet, and me just taking the opportunity to try something out. So the reason I got involved in research is because I took a research course, really loved it, did well at it, and that provided an opportunity to try out being a research assistant. I had never thought of that before. I didn't even really know what that meant. And I decided to do it. I had another time where somebody said that they were involved in the lab and they needed more people. Was I interested? And I decided to just say yes. I had no idea what that meant. And similar to what Dr. Roos was saying, that some of the courses I thought I should be doing and that I thought I should be good at were just very unhappy experiences of trying to push through a biochemistry course that I really didn't like. And that eventually it was a decision that I loved all my psychology courses and the material that I was learning there. And that was enough to kind of decide that this was something I was more interested in than what I was trying to kind of struggle through.
Thank you so much, the both of you, for sharing your journeys into psychology. Like you mentioned earlier, the both of you are involved in the Hearts and Minds Lab at the University of Manitoba. Dr. Roos, what has been your experience like co-directing such an interdisciplinary team?
Yeah, it's great. It's super fun. We're getting the opportunity to work with students at every level of undergrad and into grad school, and now as Emily as a postdoc, and having a co-director who's a developmental cognitive scientist is really wonderful for providing new perspectives and new methods to the study of mental health and family well-being. So, working with young kiddos, it's not the type of research where one person can do an assessment really well or provide support services very well. It really takes a team approach. So when we have families come into the lab, for example, we have 4 research assistants who are there to meet them, to help out with childcare, with explaining the process, with helping manage some of the physiological recordings that we do, like we measure heart rate in the autonomic nervous system. Sometimes we measure brain waves with EEG. So it's really, I would say it's really fun, and it's a nice opportunity to work with people who have different interests and different skill sets under the larger umbrella of wanting to support family well-being.
Thank you for sharing your experiences in that role. And as a general question for both of you, what are some projects that you have been or are currently involved in, and what are some of the most important takeaways you took from them?
Sure. So I can talk a little bit about some of our more basic science research, and maybe Emily has involved in a number of the clinical science projects. One of the projects that we're doing is trying to understand how parents support children's ability to manage challenging experiences. So manage things that are frustrating or stressful, or a little bit emotionally upsetting. And in order to do that, when we bring families into the lab, we actually have kiddos do challenging or frustrating tasks where they can't win at a game, for example, or they don't win a prize that they really wanted to. They do receive the prize at the end of the visit, but for about a 10-minute period in the middle, they think that they haven't gone fast enough in this challenging game to win their prize. And one of the things that we look at there is how parents use different strategies to support children's ability to cope with that frustration or disappointment. And it's been really informative because there's so many different ways that you can, on the outside, help kiddos manage their distress. So you can distract them, you can say it doesn't matter, you can give them a hug, you can try to start another task. But one of the things that we found is that at the physiological level, so looking at kiddos' heart rate and stress hormones, in preschool, the role of physical touch and comfort for parents is most important for helping kiddos' stress system go down over time. And that's been really interesting to me in our clinical work because it has informed emphasizing parent strategies to always be there to be physically able to support your kiddo. So even if they're frustrated, it's okay to leave the room and it's okay to ignore behavior for a time, but kiddos might really need that physical comfort to sit on your lap, to read a book together, to have a tight squeeze in order to bring their physiology down, because it's so hard to tell what's going on internally for someone just based on their outside behaviors. So that has been one study that has been really interesting to be working on.
And I can speak to the more clinical interventions that we're working on. One of the kind of overarching ones that has been parsed off into a couple other projects is called the Bridge Parenting Program. And that is a program that Dr. Roos created that is a combination of a mental health intervention for mothers with parenting skills training. So that is for mothers of young kiddos, so 3 to 5 years old right now, who have a mental health concern, primarily depression. And so it works to both improve their symptoms of depression, as well as directly use those strategies to improve their parenting. So one thing that we know is mental health, and in particular depression, really impacts parenting ability or behaviors in that parent-child relationship. And that's a mechanism through which we see outcomes in children who had parents who were depressed or had other mental health concerns. So it's really looking at improving this intergenerational transmission of mental health. So that is one program that that Dr. Roos had piloted earlier this year, and we have since just started again, this time with some adaptations for COVID. So we are conducting it all virtually over Zoom, just like this, and as well as using some different types of kind of mediums for delivering that therapy. And as a result of some of the work that we've done to adapt this program, we are launching a parenting skills training program in January to help with parenting stress. So not looking at mental health specifically, but acknowledging that there is widespread parenting stress as a result of COVID right now. And so we have pre-recorded videos that we're sharing we're going to use as an intervention to look at whether these pre-recorded videos or different types of activities that we can provide will help improve parenting stress in the context of the pandemic. And that program we're calling the Space Parenting Program. So that is one that's coming out shortly. And the last one I'll just kind of speak about broadly is we have one mental health app and parenting skills training that we are in development for mothers. So that is called Beam. And that one is in the process of being developed, and we have a grant in right now to the Movember Foundation, and we're hoping to adapt that to fathers so that we can really help both parents manage both their mental health and parenting. So it's using a similar philosophy to the Bridge program, where it's combining this mental health approach with parenting skills.
Thank you for sharing those projects. They sound very interesting, and we hope that you'll get a good outcome from them. Our next question is a general question, and it is, what is a day in your life like? What do you do on a regular work day? And could you tell us how your day has changed due to COVID-19?
Sure. So it's changed a lot due to COVID, yeah, happy to share what it might normally look like in some of those changes. I have 2 young kiddos and 2 dogs, so my morning is normally spent, navigating, getting people dressed and fed and hopefully showered before getting going in the morning. And then typically I would go to work at the university, and I might have a couple meetings in the morning with students, and I try to generally have some hours blocked off in the morning to work on a writing project. So that could be writing up a publication, working on a grant, or editing student work. In the afternoon, I might have a faculty meeting to talk about something like student admissions this time of year, and I may teach a class. So one of the courses that I'm currently teaching is program design and evaluation for school psychology and clinical psychology students. And that's a graduate level seminar with about 12 to 14 people, where students work directly with a community organization or school to help them better understand some of the mechanisms of change in a program that they're using and the types of outcomes that are changing. Later on, I might wrap up for the day, answer a whole bunch of emails. I probably get about, 30 or 40 a day. I don't count them at all. They just try to answer them whenever they come in, and head home, maybe trying to get in a yoga class if I can before picking up kiddos, and doing dinner and having a relaxing evening. I would say I work in the evenings about every other evening or so to do a little bit of work in the evenings if I haven't had a chance to get things done in the day.
So as an associate postdoctoral fellow, I'll explain a little bit what that means as well. So that means that I've completed my PhD, I've done my graduate training, but that I'm doing a research specialty with Dr. Roos. So I am on a trajectory to hopefully have a faculty position just like Dr. Roos, in which my day would look very similar. But as a postdoctoral fellow, my work has looked very different since COVID. So I was a resident at HSC, finishing my clinical training until August of this year. And I would have started my postdoc in September, and much more probably in a bit of a trickle effect into my postdoc, but instead with COVID and with the launching of Dr. Roos Parenting during the pandemic study, which launched at the beginning of April, I basically jumped on board and put a lot of my extra time into starting my postdoc a little early in order to be part of that work and get some of these other projects off the go. So since starting my postdoc in September, one of the things that has majorly drawn me to academia is flexibility of schedule. So a lot of my day, especially with COVID and not being able to go to the campus, is contingent on my own scheduling. So just like Dr. Roos, I generally start my day with some meetings. I, depending on the day, might kind of start a little early and get some revisions on student manuscripts done first, and then have some meetings in the morning that will sometimes look like student meetings. I'm supervising a number of honors students and graduate students on those honors student theses. So typically several meetings, and then block time as well to work on publications or research or data analysis. Throughout the week, kind of as a whole, I am one of the facilitators on our intervention study 2 days a week right now. So I have one afternoon and one evening where I'm leading group therapy. And then we have some team meetings for various projects throughout the week as well. So whether that's in combination with Dr. Roos or as the lead on those studies, I'm managing several projects. And then, as mentioned as well, I am able to kind of dictate when I'm finishing up for the day. So I might, finish up and whether it's do some yoga or have a workout or take my dog for a walk, and then some evenings come back and do some more work, or take the evening off. But essentially, it's a lot of kind of deciding what my schedule looks like. And there's fluctuations if we're in the middle of writing a big grant or getting a big paper out. But for the most part, that's definitely the benefit of this job, is that you get to make those decisions. And throughout my graduate training, I was sometimes on campus and sometimes working from home as well, because that's always been where I'm most efficient. So that's a nice thing about academia too, is there's flexibility in how you can work as well.
Great, thank you for describing the day in your life to both of you. Our next question is also a general question. Just simply, what is the most exciting part of your day?
Sorry, I have a kiddo working beside me on her iPad while my other kiddo's asleep. So I'm multitasking a little bit right now. Most exciting part of my day is probably meeting with students to hear, new results from a project that they're working on, or hear about progress about some of their learning or insights. It's really interesting, in working with families and people directly. I think it's a little bit different than maybe a laboratory-based setting where you might not know the results until the end of the study, but you often have really interesting observations about like how people are managing challenging situations. An example of that was the observation from some of our student research assistants that one of the most effective ways that kiddos seem to cope with some of the challenging tasks are through self-talk. So they'll be doing a task that they can't do, but they'll say, that's okay, you win some, you lose some, you can try again later. And these are like 2 to 4-year-old kids, so it's really, really sweet. So I love hearing about insights from people who are, hands-on in the research. So I think that's probably the most exciting general part of my day. When I'm working clinically with a client and they make major progress or accomplish a goal that they've been working on for a while, that's also really a moment of shared excitement for me.
Yeah, I echo a lot of that as well. So I am also a senior clinical associate at KidThink, Children's Mental Health Services. I work there about half day a week. So when I'm working with clients directly, I love hearing about the progress that people have made, or their small wins that they want to tell me about over the last couple weeks. And that's, I completely agree, total shared enjoyment and really kind of energizing. And then otherwise I love statistics and data analysis. And if I have a chance to kind of sit down and really work through the data and do some analyses and kind of get to those results, that's really exciting for me as well.
Great, thank you. Our next question is for Dr. Roos. Is there anything that surprised you when you first started out as a clinical psychologist?
Anything that surprised me? I'm not, it's really hard to say it. Nothing is coming to mind directly. I think one of the biggest things in, starting to hear people's stories and hear about the types of things that contribute to mental wellness or challenges is really all of the things that people manage in their day-to-day lives that you don't know about. I'm always so impressed by the different things that clients are managing or the challenges that they're facing day to day, whether that, is with their personal lives or, traumatic events that they've experienced or interpersonal things that they're managing, or things, directly in the home. So I think that, was surprising early on and continues to impress me today, and just helps me try to approach, people in clinical work, but also in the general world around me, with the assumption that everyone's doing the best they can in their circumstances, even if we don't know what those circumstances are. So I think that's one thing that comes to mind in the clinical psych area.
Okay, thank you for thinking on your feet and sharing that with us. Our next question is a general question as well. From your professional stance, how much more important do you think mental health awareness has become amidst this pandemic? Do you have any advice for those who may be struggling during periods of isolation?
I think that certainly early on, there was a very big push in the media, in the news. Lots of people right away saw the potential impact that the pandemic could have on mental health, and that was a big point of discussion. As over the course of the pandemic and a lot of the work that we've been doing as well, we've seen, especially in mothers early on, and in fathers, a 3 to 5-fold increase in mental health. So, for instance, instead of mental health concerns being, 10%, 1 in 10 mothers, it's gone up to 4 in 10 mothers have reported depression or anxiety concerns. So I think over the course of the pandemic, we've both seen that awareness increase, and provinces did different things early on to make supports widely available and freely available. But there's certainly a new subset of people who also haven't had mental health concerns in the past, who likely aren't accessing supports or know how to access them. Some of the research we've done as well has identified that there's a lot of people using the internet to just find mental health information without actually seeking professional help. And only about 25% of the people who have mental health concerns were actively seeking support. So there's a lot of people who aren't able to get or aren't seeking out that same kind of help. So while I think there's been a lot of media reports of the importance of mental health, there's still a lot more that needs to be done. And the reality is right now is that we don't have the same kind of widespread support to offer at the same time. So one of the projects that Dr. Roos has been leading, the BEAM study, which is the app for mental health, was a direct result of the COVID pandemic. So that was funding that was received earlier on to help with the widespread reach of mental health supports. And the same is true of the Movember Foundation app that we're hoping to develop. So I think there's been a real push for mental health concerns, and also in the current situation right now, that's a lot of what we're trying to do, is that it's not necessarily enough to just have that kind of awareness, but we need also solutions to help manage those increased needs, for sure. Anything to add?
Yeah, I think mental health has come to the forefront of many people's minds during the pandemic, particularly with social isolation and reduced access to some of the self-care strategies that people use day to day. So that is definitely really important. At the same time, I think it's important to recognize that mental health challenges can look different person to person. So one of the findings that I think Emily mentioned that was really striking in our data is that although we do see, more problems across the board on average, that it looks like the people who are experiencing more severe difficulties are folks who have, previous experiences of mental illness and diagnoses. And for example, in the intergenerational mental health literature, we know that it's most impactful on the parent-child relationship when parent suppression is persistent or happens at multiple time points over a kiddo's life. And for me, that really speaks to the importance of, targeting mental health early, and really not relenting on trying to be creative about different ways to provide support for families who are looking for it, even if the first program didn't work. So there are lots of programs out there, but they don't help everyone the first time, and any given program might not be the right match for someone. So I think really to encourage, clinicians and, people generally that with the right match and with the right additional supports, it can be really possible to improve mental health. And I think it's worth doing, even if it doesn't happen the first time you take therapeutic reports. My border collie also says hello.
Great, thank you so much, both of you, for emphasizing how important mental health is. Yeah. Our next question is a general question as well. And it is, what exactly is anxiety and what does it take to medically diagnose someone with it?
I'll let Emily take that one.
So anxiety would look like clinical levels of worry or nervousness. It's, lots of people have times of being worried or feeling nervous, or feeling anxious. But really we're looking at clinical levels of anxiety when we have either distress, so where it's very distressing to the individual or that they're feeling that way, that those thoughts are coming to mind, they can't get rid of them, or when we see impairment. So when that anxiety is getting in the way of going to work or socializing with friends, or their ability to perform at school, or in other different ways. There's lots of different types of anxiety, but kind of to lump them all together, it's when those symptoms like that kind of constant worry or on and off worrying that's taking up a lot of time or causing a lot of distress. It might look like more specific worries, like just around social functioning. So getting up and, performing in front of people or speaking, public speaking is a very common one. It could look more specific again, like a phobia. So, being very afraid of spiders, for instance, to the point where you can't stop thinking about spiders. You can't go into crawl space at all, even though you really had to for some reason. But oftentimes when we're talking about kind of the worry that we've mentioned in our study, we're talking about more of kind of a general worry. So the way that we measure it is indicative of clinical anxiety, but it's not diagnostic anxiety. So it's not looking at, we haven't diagnosed these people with anxiety. Instead, it's looking at how many symptoms do they have, and is that reaching a threshold that would give them a high probability of meeting a diagnosis. So the way that we would actually have to go about diagnosing these individuals is through more of a clinical interview. So if people present to their general family physician, or if they come to a psychologist or a psychiatrist, those are all ways that they could get diagnosed with anxiety. But the other important thing to note is that a diagnosis isn't necessary to be able to get treatment for anxiety. So whether you kind of meet the criteria that we have in our manual of what anxiety is or not. You can still get treatment if you have symptoms that are distressing or impairing in some way. So it's, a bit like a checklist, but at the same time, that checklist isn't as important as, if people are seeking out support, that those are things that we can offer support for anyways.
Great, thank you for speaking about a term that is widely used, but a lot of people may not know a lot about. Our next question is also a general question. What kinds of challenges do you encounter and what kinds of decisions have you had to make?
It's related to the job, clinical psychology research, any of the above. What's your most interest?
Anything you want to talk about, your job or specific people or studies you've come across, anything.
Sure. So I think one of the challenges that comes up in a lot of research related to mental health is most often you're trying to understand the efficacy of a given treatment program, treatment protocol, or approach. And as some of the things that we've mentioned, it's most often true that any given program might not be the right fit for a client at that point in their life. So it's really, really fantastic to have clients improve in their well-being, have more of that self-confidence in their role as an individual, in their role as a parent, in their role as a child. But it's also really challenging when you feel like the services or supports you're providing aren't meeting someone's needs enough to see a really big improvement in mental wellness. Sometimes that's because there's more systemic issues at play. So factors like racism, poverty, family processes that might be like just have more weight in impacting someone's well-being. So a mental health support is not going to help move them enough towards where they want to be in mental wellness. And in those situations, we typically advocate for more external supports and connection to other community resources that might help meet their needs there. A big picture are, let's say some of my hopes that I think are aligned with Emily's are for the province and for Canada to take more of a stepped care approach to mental health. That means providing, evidence-based, relatively light touch clinical services to anyone who's experiencing psychological distress, because it's worthwhile for anyone to help improve their well-being. But to also do more systematic research on families or individuals who might benefit from more supports. So in the same way that it might not be feasible for someone to meet with their doctor for an hour every month to check in about their health and see how things are going, but you might strategically encourage some people to have more medical care because they have more needs. I think that we should really move towards an approach that provides everyone with sufficient mental health care for whatever their needs are in the moment, and then provides more targeted and intensive services in mental health, but also in income support, housing support, maybe educational support to any individual or family based on what their needs are. But we need a more wide-scale investment in the research to understand how to learn about who needs what and when to really promote that mental wellness.
I'm just going to agree with everything you said, but I guess I will add, I think in terms of, I do a lot of work with children and youth clinically. And one thing that is very apparent the more time I spend working with children and youth is, as Dr. Roos talked about, is more of the kind of systems issues at play. So, that's what really got me into looking at parent interventions in particular. But, getting one person kind of into your office to work on a mental health concern is great and important, and people should definitely work on their mental health individually if that's what makes sense for them at that time. And there's also often lots of other things at play that could be improved that would also help improve mental health. So when it comes to children and youth, working with parents is often very important, sometimes taking more of a family systems approach and working with the whole family. Because it is, everyone in a household is interacting with each other and there's lots of different things at play. Sometimes it's really important to talk to school and bring school in and how they can support the youth. So, while we often will get, one individual in our office to support them with mental health, it's often so helpful to bring in, more of the important parties and people to best support the individual. And that might look like also bringing in other resources and trying to get people connected in other ways. So mental health, is a little bit like that picture of an iceberg where there's one thing at play and you can address that, but there's often lots of other things that could also be supported in order to help the longevity of that treatment as well.
Great, thank you so much for walking us through some of those challenges. This next question is specifically for Dr. Roos. What do you think is an important skill that psychologists should possess, and what skill do you possess to make you successful in this?
It's an interesting question. One of the things that I think is really important for psychologists to hold on to, and I think is a skill that I have come to over time. It's consistent with one of the therapeutic frameworks that we work in called dialectical behavior therapy. And it's this idea of holding both acceptance and change. So being able to empathize with a person for where they're at, to validate the emotions and challenges that they experience as being really real. And consistent with what I had previously mentioned, that like people are absolutely doing the best they can based on the skills they have and the resources that they find themselves surrounded by. While also, in addition to that acceptance piece, holding that if people want their thoughts to change, their emotions to change, the things that they surround themselves with to change, they will likely have to make more effort or different types of effort, or be provided with more resources in order to change those patterns of thought, those patterns of behavior, and have their interactions with people around them change too. So I think that I can be very problem solving oriented. And it took me a long time to realize that sometimes it might not be possible to change where someone's at right now. So my task as a clinician might just be to accept and validate that what someone's going through is incredibly hard. It's incredibly unfair. It makes sense that they're having really negative emotions. So just tolerating that distress that a client's having while also tolerating it myself. And thinking really slowly over time, what are the skills that might help them tolerate that with a little bit less pain, to bring in more social support of people who might have shared experiences to help them walk through that discomfort. And in other cases, thinking about, what are the changes that would be helpful? Is it a different housing situation? Is it a different parenting approach to get your kiddo on a new routine to make their sleep better, that we can really get excited about to make a change and then see improvements? But I think it's really important to be able to think flexibly between those two dialectics in order to understand what might be most helpful for any individual at any point in time.
Thank you for speaking on those essential qualities that help you in your field. Our next question is for Dr. Cameron. What are your long-term career goals as a psychologist?
Yeah, so I am, my long-term career goal will be basically to be in the position that Dr. Roos is in. So I'm hoping to work as a professor at a university where I can continue conducting interventional research, looking at family systems, a family systems approach. So working with parents and families to support child development and child well-being, as well as overall family well-being. So a lot of what we're currently doing, just in a position of directing my own lab, and as well as continuing to work with individuals clinically. So that is one of the great things in our role, is that we have the research training and the clinical training. And of course, that informs my research, and I conduct clinical research. But it also means that I get to put on a couple different hats, and I get to spend time with clients directly and work to improve mental health with children and youth and families. So I'm aiming to do a lot of what I'm currently doing, and just shifting to the director of a lab down the line.
Thank you. We have no doubt you'll succeed in achieving those goals.
Thank you.
Final question is a general question, and it is, what advice would you give to a high school or university student who is unsure of whether or not psychology, and to a larger extent the health sciences, is the right fit for them?
That's a great question. I think my biggest suggestion would be to try it out. So volunteer in a biochem lab, volunteer at the hospital working with patients, volunteer in a psychology research lab, and learn about what you love, and really lean into those experiences to do more of those and get more experiences in similar areas. I think at an intellectual level, you need to be inspired, but you also really need to be inspired and energized by the day-to-day work. And then the best way to get that experience is by volunteering and working in those areas. There are also a lot of different types of funding supports at the University of Manitoba, through Children's Hospital Research of Manitoba, for example, that can provide summer studentships or paid positions during the year for students. So that's something to always encourage students to ask for as well, is if you're planning to work with someone, or if you're planning to volunteer and then would like a summer job, to ask about their willingness to support you and advocate for you to receive one of those fellowships can really open the door for more full-time focused attention and experience in all sorts of different areas.
Yeah, I agree as well. I think there's nothing wrong with starting university with one idea and switching it 6 times. Every semester I had a different idea of what I thought I wanted to do, because I fell in love with a course. At one point I was going to be a chemistry major, and another time I was going to add a second, a double major as with computer sciences. So, the point of university is to explore and figure out what it is you do love. And if you love lots of things, that's great. And clinical psychology is an area where there are lots of different ways that you can kind of create a role that you will love as well. So, using your electives wisely, I think, as well. So if something sounds interesting, take it and try it. You might love it, you might not. And there's academic advisors there to, make sure that you're still taking all the courses you will, so you're not doing your undergrad for 10 years. But it's important as well to really follow where that enjoyment takes you. So I think lots of people start university with kind of a cookie cutter approach of what they think they need to end up with. And it's also great to go through and try lots of things and make several shifts if that's what's best for you.
Great, thank you for sharing those wise words. That was all our questions for today. So on behalf of Project Pulse Winnipeg, we both wanted to thank the both of you so much for answering our questions with so much knowledge and diligence.
Yes, thank you.
Happy to join in. Thank you.